Hi class, my name is Lacey and this is my first career profile, and the job that I chose is mental health home care coordinator, and it is an actual position that is open in my hometown. Um, there's a couple educational requirements for it. First, it requires a minimum of a bachelor's degree in psychology, social services, or a related field, and there is also a required minimum 2 years experience working with clients with mental illness. And then it's recommended or preferred to have experience in co-occurring disorder treatment, individual and group therapy, vocational services, or substance abuse treatment. And lastly, you have to possess and maintain a current valid driver's license with reliable motor vehicle transportation, and it has to be insured because for this job you will be working in clients' homes, so there's traveling both on and off site. This job falls kind of under social services. It's an adult outpatient program, so basically you are helping adults kind of come back into and readjust into the community, and so there are a lot of job tasks that are required with this position. You will be monitoring treatment plans and assuring continued care. You'll monitor and evaluate the client's stability and treatment needs, and even provide crisis intervention if it's needed. You'll be taking assessments of clients' previous psychiatric and medical history, mental status, diagnosis of physical and mental health, education, employment, and even daily living activities. And then you will be making official records of the client's activity and productivity. So it's kind of compare, and you'll be sharing these with other coworkers that you'll be working with, such as primary care providers, psychiatrists, other primary care nurses, specialty consultants, social service providers, and even insurance companies. Also, you will be required to help assist and support clients in establishing a primary care physician, dentist, and even insurance if they don't previously have these things. It was even listed that there could be the possibility of helping them establish reliable transportation, providing substance abuse and potential health risks information, literature, or support groups information will be required if needed. You'll participate in daily treatment plan and staff meetings. So there's a lot of job tasks required with this, but it opens up to having a varied working environment, because you do get to work one-on-one, and then you also work in small groups as you collaborate with your other coworkers. And right now for this position, it's typical work hours. It's a 8 to 5, Monday through Friday, full-time position. But that can change because this is a 24-hour, 7 days a week facility. So there can be stressors of your days running over the typical hour that you get off, especially if you're running late, or if the next shift that's supposed to come on, if somebody's running late, or if they call out. Those can add additional stress to yourself, and there may be times when more responsibility is put on to you if they're trying to establish more home care coordinator positions, or if someone is leaving and they're trying to fill that. There might be more responsibilities given to you which can add stress. But the flexibility is kind of open because you'll be able to kind of plan your day out, and you'll get to kind of travel off-site, as well as working on-site. Let's see what else here. There's a lot of benefits, at least with the facility that I looked into. They offer full medical, dental, and vision benefits, and there's also options available for you to contribute into a retirement fund. And lastly, they offer educational programs and benefits, and they also include a school loan forgiveness. So that is very beneficial if you are trying to look to continue your education. The starting salary for this job here is at least $16.10 an hour, and then there's and that depends on previous experience, education, certifications, which you can work your way up to earning. Maximum here is $19.80 an hour. So that leaves a yearly salary of about $33,500 to just over $41,000. And I looked up the average yearly salary for the United States right now, and it's about $45,000. So for where I'm at, we're pretty close to the median. I think the lower end is kind of around like $29,000, and then the maximum and that I found, I think, is about $64,000. So there is quite a bit of variance for pay in this field, and I'm sure a lot of it has to do with the number of years you have experience and what kind of education and certifications you have. Let's see, what else here. I know that this field is continuing to grow, and there's more public awareness that is happening, and for trying to meet the needs of clientele. So there's a big focus on successfully trying to reestablish clients back into the community. So I think that this area is going to continue to grow in the future, and it's a good position to have. And I would like to continue on to a master's program, and I'm really kind of interested in the mental health professional, or psychiatrist. So having this job before would be a really great stepping stone for me or for others who are kind of interested in the same field, because we'll be relaying a lot of the information back to the psychiatrist and primary care providers. And so it would be good, if I do become a psychiatrist, to kind of been on both sides and to understand a little bit more of the clients and what they're going through, and to have done this job, I think would make it more relatable. So it's definitely a position that I'm kind of glad that I stumbled across, and that is available where I'm at right now, and it seems like it's a great stepping stone for other positions and growth enhancement. So I think that's about it, and I will see you guys later.